thumb area?
Yeah.
Hi, I'm Dr. David Warwick, your local Lacey, Olympia chiropractor, and I'm going to be working with a young gentleman here, Evan, and he came in with a little complaint of left hand pain, mainly in the thumb area. What were you doing?
I sat down in class.
Okay. Then we're going to first look at the spine, because all the extremities, or like your arms and legs, attach and come from there. So we go to the area, the primary area of the body. Those nerve patterns come out and they talk to the area of the hand as well. So we go to like the main CPU or computer in the body and clear that area out. Okay, so his right leg is short, about 3/4 of an inch here. The left hamstring gets tight upon bending it right there. And the leg starts, I can feel it starts wanting to pull me in a little bit. And it goes shorter in the third position right there. So we're going to start out looking at the pelvis and the lower back area. Go ahead, raise that leg for me, Evan. And back down. Try the other one, sir. Good. So that was a check for the sacrum. That looked good in there. Now we're going to come over to the opposite side. And I know it may appear sometimes on videotape that we're adjusting the same areas. We're not. You find the area, or what we call the fixated area, realign it, and the vehicle drives straighter, no pun intended there. Okay, so we're adjusting the right sacrum. You okay? Or right ilium. You okay, Evan?
Yeah, I'm good.
And did you notice how I said there were problems over here on this side, but I went to this right side? Many times, not all the time, but a lot of times the compensation will happen on the opposite side, so your pain is typically on the opposite. All right, both legs even in that position there. Put your right hand on your lower back. Right leg went short, went longer in position 2. Go ahead, hand down. We're adjusting right side L5. So the lower nerves in the lower back go to talk to everything down in the lower legs here. Left hand lower back for me. L4. Go shorter in position 3, so hands down. Both hands lower back. Right leg went short and went longer in position 2 and 3. So we have L2 on his left side. Go ahead, lay on the left side here. It's kind of hard talking out loud and then trying to connect with you, but hey, we're real people too, And usually I don't even, I'm not talking about this. We're talking about life in general, what's going on in life. I'm not going through the whole analysis. And I'm going to lean in there. Good. And face down. Good job. Both legs even in that position, and that one. Go ahead, put both hands on your lower back. Good, back down again. I had to adjust quite a bit in this lower back. You notice the right SI area, or the right ilium, L4, 5, and L2. So I'm just going to do a nice traction to his spine. It's called a flexion distraction. And as I go through, I feel for the area of the restriction in there. Rib on the left side, right at T4, 5. Good. And we're right at T1. That already moved before I did anything. Good. You doing okay?
Yeah, I'm fine.
So this will be a good way for you to also see how his area of the hand can be affected, or shoulder can be affected, coming from the spine when we get to that. I go right between the shoulder blades, right at the top of the trapezius. 2 major muscles here. The rhomboid, they're really tiny ones in between, so people feel a lot of pain there. Just because we're on our mobile devices a lot, so we lose our normal posture. Okay, go ahead, lay on your back. Cross the arms right here. Take a deep breath and release it. Good. Sometimes we use an analysis of palpating the area, which is to touch and move the area. You can feel the restriction in here. I know he feels it right now as I come right onto that joint. Good. Okay, so we're going to start with the right hand, right arm first. No injuries here. And it was left, correct?
Yeah.
Checking the shoulder. You're right-handed though.
Yeah.
Feel that movement? So we check two major bones right there, capitate and lunate. And you're in school right now, so you know he's doing welding and that, and schooling. Those kind of postures affect your body, sitting for long periods of time and studying, which I know you're doing, right? Mm-hmm. Don't smile too much for me. Okay. All right, so we're right at the, feel the release there. Right in between here, pressure point right between the thumb here. Any pain when I do this? No. Okay, bring the thumb and the little finger together for me. Hold them there. Hold. Good. Nice and strong. Good. All right, so there are restriction on the capitate, lunate, and yes, we did hit a trigger point there. I want you to work this a little bit right in there. So what happens when things are out of alignment, the muscles start to have to work harder. They tighten up, they spasm, they get really tender. So I adjusted the thumb area. And we still weren't done. We had the other bone right here, and checking the pisiform. You okay?
Yeah.
Sometimes really tender, you got to check in with the patient and make sure they're okay as you go through. Okay. Try to move the wrist like this for me and move it downward. How's that feel through there as you stretch it?
Up here.
You're feeling a stretch through there?
Yeah. That's
Yeah, I want you to do that. Stretch it out. You can stretch the thumb out. You need to follow up with me later on in the week and see how it does. I'll give you some muscle ointment to put on the thumb area. Make sure you wash your hands really well. No pain here? Okay. All right. I'm Dr. David Warwick, your local Lacey Olympia chiropractor. Thank you for watching.